Greetings, friends and followers. This is Nurses Talking. I am Dale Barzy. As always, if you like what you see and hear, subscribe. Leave us a comment, let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, I have the very great pleasure of welcoming Rachel Kelter out of Indiana, USA. So Rachel is a master's prepared RN. She's got 16 plus years of leadership and education experience. She's a senior education project manager for the University of Indiana Center for Continuing Professional Development. She's an entrepreneur. She's got Rachel Keller LLC Consulting. She's a certified professional coach, and she's a personality lingo presenter. So welcome, 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 Rachel.
Thank you, Dale, so much for having me. I'm so honored to be here and excited to talk with you.
It is my absolute pleasure. But first of all, why are you a nurse? What brought you to nursing?
Yes, love this question. And I share a story I think many nurses share collectively on what brought us into the nursing profession, at least part of it.
Mhm.
And part of that story is caring for a sick loved one who ended up passing away.
Yeah.
And it's funny, reflecting back when I was in high school, this is when all of this happened. I really wanted to be a physician. I've always been fascinated with science and the body and human behavior. And it's funny because I don't come from a line of healthcare providers or nurses. So that's maybe the variability from
Yeah. Yeah.
other nurses' stories. But I have a lot of teachers in my family. And so, as maybe we talk through what got me into education, that maybe some of that in my own, bloodline too. But I really wanted to be a physician and wanted to be a pediatrician of all things because I loved caring for my little cousins who were the children of my aunt who passed away. And I loved tutoring and just being around kids for sure. But it's funny, I was never a pediatric nurse, and I don't think I ever would be a pediatric nurse. So it's funny how life changes. But I remember reflecting on what I thought nursing was at the time. And I remember saying, and this is just very naive on what the nursing profession is, but I said, I don't want to be a nurse because I don't want to be the one emptying bedpans. Like that was my perception of nursing. I'm
Yeah.
like, what am I thinking with that? But when you're young and that's what you think it is and you don't have any exposure experience around it.
Exactly.
But when my aunt passed away, I almost had this kind of sounds a little woo woo, but this inner calmness and clarity on, oh, I want to be a nurse. Like that's what nursing meant was truly like caring for people in their hardest times, and especially
Yes.
at the end of life, which I did end up going on and being a little bit of my career in hospice and palliative care, and I think some of that probably was driven from caring for my aunt, and it was interesting. It was just this inner knowing and clarity, and where my career has taken me, I would have never guessed, but I'm so glad though that it did take me down that path and just the opportunities I've had. So a little bit of both some uniquenesses and then similarities as a collective in the nursing profession. What brings most of us here, I think.
But it's interesting that you tell me that when your aunt passed, you had this feeling of calm and clarity. And what struck me then is that even at that young age, you felt the privilege of being in that space at that time.
Yes, yes,
That's
absolutely.
huge. That's huge. That's huge. So you didn't have anyone to follow, but you felt it early on. You got to nursing school. What challenged you?
Oh boy, lots of things for sure. I think just general transition in life, right? From, nursing was my first career, so I wasn't a second career nurse or anything like that. So followed the traditional pathway, went right to a 4-year college, the traditional, moved away, figuring out new freedom and autonomy, and I think reflecting back, that's where I really started to find myself. Struggling with perfectionism. And in nursing school, there's so much pressure, as we know, to just really to pass. But, being an overachiever, I wanted to always like do the best I could, right? And be the best at it. So just a lot of pressure on myself. I didn't really feel it as much from my parents or teachers necessarily. It was really internal, but that's probably the biggest challenge I faced. And that will continue to be a life theme for me as I've studied, my own
Mhm.
personality and human design and astrology. It's just been really interesting to see, okay, this is something the universe is going to continue to bring me life lessons around. But I've
Yeah.
accepted that.
You know what, Rachel? It's just so much easier to accept and go with the flow than to try to kick
Yes.
against it because it's going to
Yes.
keep bringing you back to that place where it wants it to be.
Absolutely. And I've definitely gone kicking and screaming at times, but finally, I think right now I'll say, it can change day to day for sure, depending on the context. But right
Yeah,
now, I'm like, okay, I've accepted this. I know who I am. How do I practice self compassion and lean into the support I have to move forward?
yeah, I know what you mean. I know what you. I've tried the kicking and screaming thing myself. It doesn't work.
It does not. It'll come right back around to you.
So you mentioned that you did a little bit of hospice. What other areas did you work?
Yeah. So when I became a registered nurse, I started out in adult critical care in an
Mm.
academic health center in the city of Indianapolis, and actually still with the same organization I am today. I always tell people I've grown up through Indiana University Health, and I
Yeah.
did some student nursing before I graduated, and then became a nurse and worked on
Hmm.
critical care. And
Hmm.
work day right out of school, work day shift. And this was a time where we did not have nurse residency or transition to practice programs, and it was really challenging. I
Hmm.
think my manager and educator at the time did the best they could, of course, with the knowledge we had, but there was just not a ton of support that I felt that we give our new nurses now. And I'm so grateful for that we do that now, because I was definitely one of those who was like, okay, did I pick the right career and profession? I don't think I want to be a nurse anymore. And I always try to bring that, normalize that for new nurses, because it's true. It's
Yeah,
really hard
yeah.
to transition. Even when you do have a lot of support, you may have those feelings and trying to normalize that. But so I did critical care, adult critical care, and I ended up loving caring for the patients. We were what we call terminal wean, or having
Hmm.
to progress them to the end of their life, as they were
Hmm.
not going to make it, unfortunately. And I love that because I love connecting with the families, and that started to open my eyes on, okay, I think maybe end of life and hospice care is something I'd want to explore. So I actually stayed PRN or supplemental 1 to 2 days a week at my critical care position,
Hmm.
and then I did a part-time position in hospice. So it was different to switch from this
Hmm.
mode of life saving to helping patients and families transition
Transition.
at the end of their
Hmm.
life.
Hmm. Yeah,
Yeah.
yeah, yeah. It is. It is. But hospice, that time of being present with somebody is so huge. It's so huge.
Yes.
It's one, I have to tell you, I have been a midwife and I have been at the end. So I've been at the beginning and I've been at the end. And both of those end are so impactful. And I
Yes.
struggle to figure out which one is deeper. And I don't think either of them are. But
Right.
to be present at the end of someone's life is a huge privilege.
Absolutely. And I think defines what nursing is about, which, sometimes I think as nurses collectively, we might have forgotten that, especially in acute care where it's very focused on medicine
Hmm.
and at least in
Hmm.
the United States, we know on sick care. And, how do we bring back the
Yeah,
presence of nurses and well-being and preventative care, or the transition at the end of their life,
yeah,
and through hospice?
yeah,
Yeah.
yeah, yeah, yeah. And as you asked the question, how do we bring back? It just brought to mind an article I read just this morning, actually, I think, and I have to really read it more closely. But the International Council of Nurses has just brought out a new definition of nurses and nursing, which is such an
Oh,
interesting article.
interesting. I would
Interesting
love to read
article.
that.
Yeah, I'll make sure I get it to you. I'll get
Thank
it to
you.
you. So, what do you think though? you want to see change with nursing as it is now? What do you think you'd like to see change to something that you think you'd like to see maybe in 5, 10 years?
Yeah, that's a great question. There are lots of things I think we have opportunities, again, especially within healthcare in the United States and what we're experiencing. One of the things I've been reflecting on and started to mention it just a little bit ago was how do we really start to focus again more on the human skills of nursing
Mm-hmm.
and both the science and appreciate that as a profession and the art of nursing.
Right.
And in most of my career, I shared my clinical background. Most of my career, however, has been in nursing professional development or education. And some of the work I've done is with our nurse residency program at when I was a director over nursing professional development. We really led their nurse residents through a complete shift and looking at human skills and human skill teaching. So, what I mean by that, more those softer interpersonal skills, like how do we focus on communication and empathy and inclusivity and building trust. And what's really interesting in the literature is that we actually can teach these skills and we can actually learn these skills.
These skills.
And especially trust, I tend to think of that as before you're either trustworthy or you're not, but that is not the case. You can actually build and learn how to build trust. And then, when trust is broken, how do you rebuild that? And
Rebuild it.
so,
Yes.
what we were hearing from those residents and new nurses was these human skills we were teaching was helping not only at work, but in their home life and in their
Mm-hmm.
parenting. And we know when we can impact the person holistically in all parts of their life, they will thrive at work. And that's what I want to
Yes.
see change in nursing is the technical skills are important. Absolutely, yes.
Mm-hmm.
But I think what makes us unique as nurses is the human side that we can bring and really putting more emphasis on those human skills.
Mm-hmm.
So that's what I would
Mm-hmm.
like to see change is more in the curriculum, maybe from nursing school into transitioning and then beyond, just even continuing education, which is the space I'm in now, is more focus on facilitating and fostering and cultivating then those human skills.
Yeah, yeah, yeah. And particularly you're talking about, personal development and continuing education. And one of the things that I have learned or I have observed, um, there's so much now in terms of continuing education and personal development. Sometimes we're finding it hard to choose where do we want to
Yes.
go, which path.
Yes.
It reminds me, I had this conversation actually very recently with someone, and it reminds me of someone I once worked with who had come from Russia, and she told me the story of how, having come to America, the first time she went into a supermarket to buy bread, and she told me she had been accustomed to being on a bread line. And
Mm-hmm.
she went into the supermarket to buy bread, and there was all this bread,
Yes.
and
All
she
the
didn't know what to
options.
do.
Yeah.
And she cried and left the store.
Oh gosh.
She cried and
Yes.
left the store.
Oh,
But I see, and I know that it's not that severe, it's not that serious in terms of choosing, but I see that sometimes we have so much stuff, it's such a smorgasbord that people are having sometimes a hard time. And people like you who can guide them is so needed,
yeah.
so needed.
Yes. I hear you with the change fatigue, decision fatigue,
Mhm.
so many options. And,
Yes.
I've really been leaning into becoming more focused as an evidence-based practice mentor and have really shifted my thinking. Yes, evidence-based, this seems like, well, obviously, as a nurse, but I've really, as I've gone through some more formal training, have really started to look at evidence-based practice differently and looking actually spending some time and slowing down. That's the part too, right? We want to move at 100 miles an
Yes.
hour, but pausing and saying, okay, what does the literature truly say, and is there probably already evidence out there to then focus on whatever that best practice is to then implement, and then we can do some more innovation around things that aren't in the literature, and maybe that is more on human skills within nursing and
Hmm.
have some more capacity to do that. And Yes, so it's that's interesting you said that because the story because I was just thinking through decision fatigue and change fatigue is something that has been in my vocabulary quite a bit recently.
Yes, yes, I know. It's creeping into mine a little bit too. I've noticed that. I've
Yes.
noticed that. So we talked about earlier on when I introduced you and you said you're a personality lingo presenter. Tell me,
Yes.
what is that? How does one become that? All the things about it.
Yes. So I love personality and personal development. It's probably obvious as I've talked, and that's also a human skill. Really, more that self awareness is probably the
Hmm.
skill. But so personality lingo is its own company, and there is a book. I believe it is called it may not called personality lingo, but the author Mary Mission, I think is how you pronounce her name,
Mm,
created this system based on a few different personality kind of like I'm trying to
mm.
think of the ones like Myers-Briggs,
Okay.
there's a
Hmm.
True Colors, lots of different
Yeah.
DISC, I think, which is not personality, it's more communication, but taking bits and pieces of that and creating the system where it's a lot more practical and to me, I feel like easy to teach and translate and then for people to learn as well. So,
Hmm.
but what it's based on four styles. And there's a connector, planner, thinker, and mover. And with each of the four styles, there are different characteristics that people tend to kind of fall into. Now, I always
Hmm.
be careful. I don't want to ever, not to stereotype, and we're all the styles because
All of
we're
the side.
people and we're complex, but we do
Yes.
lean towards one or another.
Yeah.
And what I've used with that is presenting on how do we take that information and start to look at team dynamics, especially around communication and trust have been the two biggest implications. And there's actually some more toolkits they produce, the personality lingo. One is on change that we're looking at too. But it's been fascinating because I think there's this lightness and funness to, oh, like the kind of that accepting of our quirks, kind of like I talked about with the perfectionism with me. But then it promotes this self awareness and then others' awareness to provide some more compassion and grace. And that's really my take home message with all of that. And yeah, so it's just really fascinating to see
Yeah.
the people dynamics and how they interact and even just beyond like having some common language I think is always really helpful. And so because there's only four styles that this personality lingo
Yeah.
talks through, it's a little bit easier to digest. And then people can kind of use that language. But super simple to become, actually. A qualified personality lingo presenter is what they call it. You can become a trainer. You can purchase their toolkit, and then there is actually a like a test or assessment that you do once you've taught it for a little bit, and then you can become qualified, and then you can use the materials a little bit more fluidly with some copyright things that they kind of outline in their toolkits. So really fun. I love it. I love those. Those are my favorite presentations to give.
You said when you were just talking about it just now, you said it was light and fun. And I have to tell you that when I read it, that's what came across in the name. I looked at personality lingo, presents, and I thought, oh,
Yeah. What is that?
it came,
Yeah.
yeah, I came across in the name. It's interesting.
Yes. So fun and but impactful too. So I think
I'm
that's why
sure.
I am attracted to it, and then why I get so many requests from my own bigger organization to present on it because it is
Mhm.
a little bit easier to, like I said, digest, and then could be really impactful too.
Nice, nice. So to come back to the nursing thing a little bit now, you are in education, you're in professional development and all of that. What advice, so, do you give to someone who wants to become a nurse and someone who's in transition of this and, someone who is like, they are a nurse, but, oh, do I want to be here?
Yes. So for the people thinking about becoming a nurse, I would say stay curious. Curiosity is a one of my values, and I think has really helped when I have been at those low points
Yeah.
and I struggle finding that resilience within and being able to move forward is getting curious about, and this kind of goes back to personality too, but say you're getting curious about a situation that you're in with a patient and family. And it's also empathy, but I think when you're curious about, I wonder why they responded that way, or why did I react that way? When you can get
Mhm.
curious, it comes from a place of non judgment, which I think as nurses, we are so hard on ourselves. And self compassion is a human skill I'll always recommend. And when we can talk about that, but we are so hard on ourselves. And I think first and foremost is, how do you come from a place of non judgment
Yeah.
towards yourself, which then I think will start to bleed out into the people that you're interacting with. So I'd say that stay curious because you never know where your career is going to take you. And I know we all are told that as new nurses, and we know that going into it. I even knew that, but to now
Mhm.
have lived it for 16 years, I'm like, okay, I see now that I'm in the positions I've been in. Some of them I've created myself, and I've helped create or advocated to create, and I never thought, that was not even on
Yeah,
my radar that that would happen.
exactly. Yeah.
But knowing there's so many options. And so if you are a nurse and you're questioning or you're having those thoughts of nursing seems so hard right now, and it is.
It
So, one,
is.
I hear you and I acknowledge you, and it is very hard, no matter what position you're in, whether direct care or not. It is hard. It's hard to navigate. And I would say, leaning into that curiosity and thinking about what could possibly come from even just having a background in healthcare and nursing. There's things we don't even know are possible right now, or even actual job titles or positions that
Yes.
may come in the future. And so having that background and having the voice of a nurse who is the most trusted profession, right? In different spaces, I don't even think we know what that looks like right now. And we see it every day, right? Changes like
Yes.
all these now nurse health coaches. I'm like, oh my goodness, that's such a cool position. And we know AI is, there's so many things with technology and AI. So
Yeah. Yes.
even if it's not what we traditionally think of as nursing from like a direct care in the hospital nurse, there are so many different avenues that we can take now, and we know that will continue to grow in the future too.
Yes. It's exploding. It's
Yes.
exploding. And I love it. I am really thankful that I'm around to see this because I am 50 plus years in this profession. And so you talk about just not nursing just in the hospital. I knew when I became a nurse, I knew that I could get a job anywhere,
Hmm.
practically anywhere in the world. But I always knew that to be within the institutional thing. I was going to be in a hospital or in some area in a hospital, in a clinic, something like that. Never in my wildest dream did I think entrepreneurship or
Yes. Podcasting.
coaching or being a
Yes.
consultant or I could go on. I could stay for the next 5 minutes and not cover
Yeah.
all of the things. I
Right.
saw the other day, a few days ago, and I'm trying to pursue this person because I'm really interested. A forest nurse,
Interesting. A forest nurse. Hmm.
forest, and so I want to know all the details.
Yes, me too now. There's our curiosity coming in play.
All the details because that is something that never occurred to me at all. Uh, yeah. So
Isn't that
anyway,
interesting to think
yes.
about the skill sets of nurses? And I think this also goes back to my wanting to change or amplify human skills because those core skills can take us anywhere. And then having the lens of being a nurse and being that presence for people and
Mhm.
advocating for them and then for yourself. Really, any role I feel like we could step into. I mean,
Yeah, it's a license
project
to do anything
management.
you want.
Yes, yes, agreed,
Just think
agreed.
about what you want. You can do that with what you have.
Yes, I agree.
Yeah, awesome. It's awesome. We have been so blessed, I have to tell you. But anyway, one of the things though that as nurses where we fail a lot, and I think we're beginning to do better, is that we don't take care of ourselves.
Hmm. Absolutely.
We have failed miserably in that department, individually and collectively. So I have to ask you, what does self-care actually mean to you, and what do you do to care for you?
Yeah, this is again another one of those life lessons I'll continue to have to
Yes.
learn. And it's changed, what my definition or how I
Mm-hmm.
view self-care. So I talked a little bit earlier about self-compassion. So I got to start with
Mm-hmm.
that because I think in order to really have and provide self care, we have to start inward, which it sounds obvious. Well, yeah, it starts with yourself. But what I mean by that is with self compassion, really what it is, and there's a ton of research by Dr. Kristen Neff out
Mm-hmm.
there. And she talks about how do we take the compassion, which we're so great at as nurses, that we provide outwardly and turn it inwardly. So,
Mm-hmm.
how simply do we talk to ourselves like we're talking to a friend? And that's kind of where that curiosity comes in play too. So I'm getting curious about, I wonder why, even my brain or my inner critic, we call it sometimes in the coaching world, why is it loud and telling me that I'm doing horrible at this thing
Mm-hmm.
I'm doing? And
Mm-hmm.
so the
Mm-hmm.
curiosity and then okay, well, how would I, if a friend told me this, what would I provide? So that first. And then as I've started to look at self care and around nursing specifically is how do we advocate for ourselves with boundaries and how do we advocate for what value we bring to the table. I think with my experience in nursing professional development being a newer ish, I'll say specialty, and we're still working through this is, what do you even do? This is the question I get a lot. What do you even do? What does that look like? And being able
Mm-hmm.
to articulate and advocate for that, to have, this purpose and meaning in life, I think goes a lot deeper for self-care than this is stereotypical, but
Yeah.
I just want a massage and bubble bath
Mm-hmm.
self-care.
Mm-hmm. Yeah.
And I
Mm-hmm.
think it depends on your personality too. For me, I do love to work and I love to be in I love to read and be in the literature, and I love nonfiction over fiction, very nerdy of
Mm-hmm.
me, but I
Mm-hmm.
love that, and that's a form of self-care for me. But
Yeah. Mm-hmm.
even like evaluating what that looks like for us, and knowing that it's not a one size fits all approach, and that some people may get energy from expending energy, like so exercise and just
Yes.
moving, and then some people need to rest, and rest for them may be gardening or journaling or truly just sleeping, like getting enough
Yeah.
sleep. So
Yeah.
there's so many different, I think, factors to it. Like I said, just not a one size fits all. But for me personally, I would start with the self compassion, and that
Yeah.
is what I continue to practice and need to practice for myself when I find myself getting to the place of burnout, which I've experienced a few times in my
Yeah.
career. That's where usually it's the self compassion that's lacking.
Yeah, yeah, yeah. And you were just saying it's not a one size fits all. It's not even a one size fits one because it
Right. True.
shifts.
Yes. Yes. I love that. Not a one size fits one. I love
It
that.
shifts from, time to time,
Yep.
into what you really need. And for me, the trick is, or the key is recognizing what you need at the time.
Yes,
At the time.
absolutely. Because then who
Yeah.
and what are you experiencing in your personal life? Are you a new parent? Are
Yeah,
you
exactly.
newly married, newly divorced, a change in your job and position, and moving? Like
Mm.
all these life factors that come into play. I love that you said that. I totally agree. Yeah.
Rachel, I don't know how to thank you for this conversation. It's been such an interesting conversation. I could talk to you for a long time.
Me too. This is so fun. I love it. I know our time, it always flies for sure.
It always flies. But thank you so very, very much for doing this. Any last words you want to leave us with?
just thank you so much. This has been fun and great. And again, I could definitely talk all day about all the different aspects and thoughts in nursing. But I would just say, if you're thinking about nursing or you're thinking about even leaving, just maybe just reflect on the conversation today. And I hope it's given you a little bit of hope and food for thought to continue to move forward. And I know both Dale and I are here for you.
We're here. Thank you, Rachel.
Thank you
On
so
that note,
much.
thank you very much indeed.